And thank you for inviting me back to speak. It's been about a year and a half since I last talked with the group. And so I have some updates and really an announcement about our new Precision Brain Health program here at Pacific Neuroscience Institute, our Brain Health Center, which is located in Santa Monica, California. We also provide telehealth appointments throughout the state of California. And I'm the director of the center. We've been open going on about 6 years now. We're a center within the NeuroScience Institute here that is attached to and affiliated with St. John's Hospital, Providence in Santa Monica. And so I get the privilege to work with a group of neuroscientists across surgical, neurologic, geropsychology, and psychiatric disciplines to provide the best in neurosciences services, all while doing cutting edge research as well, and doing educational sessions like the one we're joining together to go through today. So disclosures, I have no actual potential conflicts of interest in relation to this program or presentation. However, I will discuss consideration of off-label research and use of drugs, treatments, and lifestyle approaches in older adults for dementia prevention and care. Just coming into this talk, we had a big breaking news announcement that got a lot of attention for me in clinic, where I spend most of my time. I think by Monday afternoon, there'd been a segment on 60 Minutes on Sunday talking about ultrasound treatment for Alzheimer's in 3 patients. And I think I had 6 patients ask me about this by lunch. So it's been a hot topic in the news and the area. I love to start talks with some fresh information and to show how it can dovetail into what is really not only a national but a global effort to combat Alzheimer's and to help people achieve successful aging. So just to spend a minute or two talking about.
Well, there's breaking news: ultrasound treatment for Alzheimer's.
Yes. So to spend a minute or two talking about Dr. Rezai's work out of the Rockefeller Institute. I think it's over in West Virginia, if I'm not mistaken. He's using an experimental ultrasound approach, as shown on the television show, to open the blood-brain barrier and improve the effectiveness or the use of an anti-amyloid antibody to remove plaques, that amyloid plaques that have accumulated in the brains of Alzheimer's patients. If you look at this, it's really a remarkable technique. They use an MRI-guided ultrasound to open the blood-brain barrier through several molecular biological mechanisms to then allow for the antibody infusion, which is through a peripheral IV in the blood, to allow that to enter what is otherwise the protected space of the brain. So they use a microbubble infusion along with the sonification wave that both compresses and releases the blood vessels to open up the barrier and allow the antibodies to get into the brain more effectively. And so here's just a schematic. This wasn't just on 60 Minutes. This was also a groundbreaking publication in the New England Journal of Medicine, of which there was a summary. This is actually a figure from the summary report about it, showing that the treatment sequence was that at baseline, they would take scans of the brain, both structural magnetic resonance imaging, and then also PET amyloid scans, which shows the amyloid plaques of Alzheimer's building up in the brain of the volunteer subjects. They figure out where they wanted to sonicate the brain. Just before doing that, they would do an infusion of the anti-amyloid antibody treatment, and then go ahead with the sonification along with a microbubble infusion that I was talking about. And they did this monthly for 6 months. And then along the way, periodically, and at the end of the trial, they looked at the brain to check to see whether or not they'd, after verifying they'd been opening the blood-brain barrier during these windows of sonification, they checked at the end to see if they had, in fact, decreased the load of amyloid plaques in the brain. And amazingly, they had. So here's just another kind of schematic drawing. They had pictures and videos on the TV show, but for now, the patients each wore this, they called it $1 million cap that really focused and amplified the sonification to a specific part of the brain that was targeted. And then they shared with us both the baseline scans full of plaques in the brain, and then at the end of 26 weeks, the area where they had sonificated had significantly fewer amounts of amyloid beta plaques in the brain. Pretty amazing. So you see they have the time points in the 3 volunteers. The graph that's going down is where the treatment was focused. And this is quite significant, quite dramatic. You don't really need a graph. You saw it visually. That's the good news. And it's a wonderful proof of concept. It's short in terms of ultimate treatment. The usual treatment of the infusions keeps going beyond 6 months. And also the sample size is quite small. So not surprisingly, they did not pick up any cognitive or functional changes in the volunteer subjects. They weren't better, they weren't worse. So it was really just the beginning. So this was 3 subjects, years of work, hundreds of thousands, if not millions of dollars of effort, and they're able to demonstrate it in 3 patients. So what's next? So with continued funding and support enthusiasm, their group and others across the world are looking to use ultrasound treatments to target clinically significant areas, not just on one side, but both sides of the brain, and test whether or not this approach is efficacious in slowing Alzheimer's progression. Is it safe? And is there a way to do this without having everyone be in an MRI scan, to have the $1 million cap on while they're doing the treatment? Is there a way to make this more widely available? Also, there's controversy about the antibody infusion approach. Is that ultimately going to improve cognition, or is it even safe or advisable to remove plaques rapidly from the brain? So as such, one might consider alternative approaches, such as using different drugs along with opening up the blood-brain barrier. For example, you could consider putting in stem cells or exosomes derived from stem cells along with this sonification. You could consider using chemotherapy drugs. There are some trials with those types of interventions, or harkening back to my graduate school work where we were doing infusions of brain-derived neurotrophic factor. Wouldn't it be great to come up with a way to use ultrasound so you could non-invasively deliver brain-derived neurotrophic factor across the blood-brain barrier? You know, something that at this point remains conceptual and is not ready for application into treatment. Not only that, could ultrasound actually be used as a treatment in and of itself? So if any of you saw the 60-minute show, they also talked about use of sonification for Parkinson's disease and for substance use or dependence. And in those cases, they were actually using the ultrasound as the treatment, where they were targeting specific areas of the brain. And that is one group doing it. I'm glad to announce that over here in West Los Angeles, where I'm located in Santa Monica, if you happen to be within driving or traveling distance, there are clinical trials ongoing using low-intensity focused ultrasound pulsation, aka LifeUp, as a treatment approach. These are being led by Drs. Taylor Kuhn and Susan Buchheimer. They have pilot trials up and running for mild cognitive impairment. We'll get into that's a pre-dementia state, as well as Alzheimer's, Parkinson's, and general anxiety. With the LifeUp sonification, you're targeting deep regions in the brain non-invasively, areas that are related to learning, memory, moving, and emotion. This can safely increase or decrease the activity of these brain areas, and we're using pulses of sounds. We're not heating the brain. It's generally safe, non-invasive. You're looking for changes in blood flow and function of the brain areas. What if you're really interested? Well, you can certainly Google this, or I can help you out. So if you take a screenshot of this or write down the information, it is a study. So they have very particular inclusion and exclusion criteria. But if you seem like you fit, age 50 to 90, right-handed, English speaking, with a diagnosed memory issue, you may qualify for their mild cognitive impairment or early Alzheimer's study. If you have one of the other conditions I mentioned, Parkinson's, anxiety, and the like, you may qualify for one of their other studies. So you would just give them a call at 310-794-0074, or you can email them at the email below. Beyond and besides ultrasound, what about using transcranial magnetic stimulation as a treatment approach to optimize brain activity, boost BDNF, so-called brain-derived neurotrophic factor, and improve memory? So transcranial magnetic stimulation, which I'll show in a moment, is used. Basically, you're applying an alternating magnetic field to create an electrical potential in specific parts of the brain, again, to optimize the activity, much like with the ultrasound. It's just a different methodology. And so a different group from ours recently published in Brain, precuneous magnetic stimulation for Alzheimer's disease, the results of a randomized controlled trial in about 50 patients total. So 25 got the sham, 25 got the active treatment, and they targeted this area that we know early on in Alzheimer's disease, the blood flow decreases in this area, the activity decreases in this area, and there is neurodegeneration going on there in connected regions. So they brought in volunteer subjects who are persons living with early stage Alzheimer's, and they gave them an intensive initial phase of 1 TMS treatment a day for 10 sessions for 10 days, weekdays. And then they did a maintenance phase where they did weekly sessions for the rest of the weeks up to 24 weeks. And lo and behold, they're finding significant benefit compared to doing a placebo, and compared to giving a sham treatment where they make the sounds of the TMS and they have the sensations, but it's not actually activating the brain. And you see the results. So I'm sorry for all the initials of all the different tests, but basically these are tests of global cognitive status, daily living function, tests used in Alzheimer's disease trials, and one called the mini mental, which is a global cognitive scale. And similar to the prior studies I've been sharing, the active treatment is potentially slowing down progression or lessening the worsening. Now, people are not getting all better, and that's why we really need to keep working on this approach. And similar to the ultrasound, there's actually active clinical trials, and this time a different part of the brain, lateral parietal lobe, mechanistic trials that have been published and ongoing, and also there's another opportunity at UCLA, which is nearby, where you may qualify to volunteer for a transcranial magnetic stimulation study for early Alzheimer's, in this case, mild cognitive impairment, which is an even earlier state of having the syndrome of Alzheimer's disease beginning. For that study, you might want to call Dr. Suthana's lab at 310-210-6978. Now, we have a lot of cutting edge studies going on across the nation and the world. We're really trying to and need to improve the standard of care for Alzheimer's. And why is that? Well, historically, in medication-based memory clinics, cognitive decline with Alzheimer's happens at about 2.5 points per year of decline on a 30-point MoCA test, which is similar to the mini mental test. It's kind of an office-based test. Some of you or your loved ones may have done this test. I believe our former president did this test and passed with flying colors. But this test tends to decrease about 2.5 points per year over time when we do nothing for the disease, or we give what has been standard treatments, which are limited available prescription medications. Along with the cognitive decline, there's also brain shrinkage of about 2.8 to 3% per year on the MRI. And beneath here, I'm just showing some figures of some brain MRIs and graphs of quantifying a patient who was followed longitudinally in an observational cohort study from 2009 to 2015. You can see basically the memory center hippocampal volumes continue to go down year over year, about 3% per year. So we still need solutions. We don't have a cure. We really don't have a definite quick fix. And so there may not be a quick fix, but we're looking at what can be done to improve the standard of care, because as we know, the natural history of Alzheimer's and related neurodegeneration is to get progressively worse over the months and years, to the point where we go from being in a preclinical state where the disease process has started, but we're not symptomatic, into a dementia state that can progress from mild to moderate to severe. And in the full-blown dementia states, the brain degeneration has progressed to the point where we're having symptoms that interfere with some everyday activities. First, the complex ones like driving, balancing a checkbook, making a menu, or planning or cooking a big dinner. Later on, the symptoms interfere with many everyday activities, including even the most simple things like bathing, dressing, transferring, toileting. So it's really incumbent upon us to figure out a way to slow down and or stop this disease, as Alzheimer's is the most common type of dementia in the world, with over 55 million cases currently, expected to potentially even triple by the year 2050, up to 150 million cases. Now, age is the largest single non-modifiable risk, and there are some genetic risks for Alzheimer's which we don't have control over. And as I was mentioning, first, Alzheimer's is having mild memory loss. It progresses to affect other cognitive domains. And the underpinnings of this, or the pathology, are thought to lie in the amyloid beta plaques, which are deposits of misfolded proteins outside of the cells, and neurofibrillary tau tangles, which are misfolded and phosphorylated proteins inside the neurons. As this pathology builds up, we have loss of the connections or synapses between cells over time. Eventually, we have frank cell death, and the brain continues to shrink. So, what are we working on? What are we working towards? What can you do today and tomorrow together with us and others to slow down and prevent Alzheimer's from happening or progressing? One example of a genetic risk is called ApoE4 type allele, which is the largest single gene linked to Alzheimer's disease risk. There's 3 variants. We get one from each parent. We inherit one from each parent. Less than 5% of people actually have an E2 variant of the gene, which decreases risk of Alzheimer's. Most individuals, about 75% of the population, have both a 3 from their mother and a 3 from their father, where the risk is neutral. And some individuals, about a quarter of the population, have either 1 or 2 copies of the higher risk version of the gene. Now, luckily, only about 2% of the population has ApoE44 genotype. If you're 3-3, the lifetime risk of Alzheimer's is about 11%. If you're 3-4, it goes up to about 30%. And if you happen to have 4-4 as your genotype, about half to upwards of 3/4 of individuals develop Alzheimer's at some point in their lifetime. Now, for me as a scientist and trying to remain hopeful, I hear that there's some individuals with ApoE44 who do not develop Alzheimer's disease in their lifetime, and there may also be some where we can do something because ApoE genotype is a potential target or way that we can approach precision medicine interventions to improve the outcomes of the person. For example, exercise interventions, dietary interventions seem to work better in those carrying the ApoE4 genotype. And we know this because of the science behind ApoE4 that's been studied over decades and thousands of scientific studies. We know that ApoE4 contributes to disease-associated microglia-based brain aging, astrocyte-associated inflammation, and this time the unhealthy breakdown of the blood-brain barrier, and also insulin resistance in the brain, also known as type 3 diabetes. That's a paraphrase. So in this sense, when we learn somebody's genotype and we know they're carrying a risk factor, it doesn't mean that it's inevitable that the person will end up with Alzheimer's. What it means is we have more knowledge, and with knowledge comes power. So what can we do when somebody's ApoE4? Well, we can actually prescribe a diet for ApoE4 carriers and ApoE4 individuals to counteract the brain effects of this gene. In general, we know that a lower carbohydrate diet lessens insulin resistance, lowers the buildup of the plaques and the tangles, and there's a reduced prevalence of Alzheimer's in individuals on a lower carbohydrate diet. This type of eating is also associated with thicker brains, which I'll show more on in a moment from our group and others. And the lowest carb version of this, which can be hard to sustain, is called the ketogenic diet. There's also Mediterranean style diet that has some of the similar lower carb aspects, but it's not quite as hardcore as going full keto. Any case, you may want to work with loved ones, family members, clinicians, dietitians to think about and work through what's the composition of carbohydrates in your diet and how can you optimize those to support your brain health. Some individuals on ketogenic diets have actually shown symptomatic improvements in Alzheimer's, but like I was saying, it can be hard to maintain mild ketosis long term. That's why even for those who are successful in doing it, we don't necessarily recommend that they do it all the time. They may cycle in and out of mild ketosis throughout the year. Other ways to prescribe the diet for ApoE4 individuals includes copious amounts, we're talking tablespoons a day, of extra virgin olive oil. And that doesn't have to be high-end, crazy, expensive, off-the-shelf. If you look at Trader Joe's, their premium Italian version is really high in the polyphenols. Along with the oils, you look at cruciferous vegetables, not only anti-Alzheimer's, but also antioxidant, anti-carcinogenic. So generally good for healthy aging and healthy brain aging. Everybody's at this point knowing that fatty fishes with their omega-3s like salmon is very good for the brain and the body. And really, we now know that with ApoE4, you want to limit alcohol intake. If you're symptomatic, you might even think about just stopping alcohol intake altogether. So that's one way. So scientific data. From our research group here at Pacific Brain Health Center, we looked at a group of about 40 volunteer subjects with positive amyloid PET scans, meaning they have the beginnings of the pathology of Alzheimer's, and we inventoried how many carbohydrates were generally in their diets. And we were finding, as a matter of fact, that the lower carb diets associated with greater brain thickness. So this is really exciting. It's something that we want to study over time in the context of intervention trials, and to really see, like, does this make a significant difference, not only in the thickness of the brain with the concept that maintaining the volume of your brain is good for you, just like maintaining your bone density or maintaining your muscle volumes, but does it also relate to cognitive performance or memory performance over time? I was mentioning muscles and bones because we're also finding that muscular strength, like grip strength and resistance training, along with balance and mobility, those have positive associations to brain health, both structure of the brain and then ultimately cognitive performance. Even since the ultrasound study, there was a more recent breaking news article that came out of our research group and others working collaboratively that even a little exercise may go a long way towards increasing brain volumes and slowing memory decline. Now, you don't need $1 million ultrasound hat. You don't need a big expensive scanner or a university. You really can just go out the front door. And what was found in the study was that even exercising moderately for just 25 minutes a week related to larger brain volumes in areas critical for learning and memory, like the hippocampus, which is basically where all the memories go through to get formed in the brain, and also really critical cortical areas of the brain, like the frontal lobes. That's where the frontal executive of the brains are, the parietal lobes, and occipital, where there's a lot of visual spatial processing and planning going on in the brain. So really, if you look at it, just 25 minutes a week of exercising, about 1/6 of the American Heart Association's weekly recommended goals for exercising, relates to and can result in you hedging your bet that you will be maintaining your brain volume across aging. This was across all ages, from adults from age 18 up to 97. I don't know if we have any 98-year-olds out there, but I'd imagine it'd be good for you too. The best type of exercise is the type that you can do safely. So walking if you can walk, swimming if you can swim, maybe stationary bicycling or other types of workouts. Really, the key underlying point here is just to get your body moving, and that's going to start going a long way to boosting and maintaining your health. And is dementia really preventable, or can you slow it down through lifestyle across the lifespan? So the question I always get in clinic is like, is there really evidence for healthy lifestyle and AD prevention? Well, I'll tell you. If healthy lifestyle were a drug, we'd prescribe it to all our patients. Upwards of 40% of dementia cases may in fact be preventable by addressing one or more modifiable risk factor. In early life, we're talking about education. In midlife, we're talking about avoiding things like traumatic brain injuries, addressing hearing loss, avoiding activities of excess like alcohol overuse. In later life, it's about not becoming socially isolated, remaining physically active, and making sure that your medical health factors are being addressed: blood pressure, sugar metabolism, lipids, really to then ultimately achieve what's called successful aging or healthy brain aging. And this is really not just my opinion, and it's not just little trials that we've done, one-off trials. The data comes out day after day after day, and in larger and larger samples from all over the world. So, for example, in December of 2023, there was something that came out about the UK Biobank. In their country, they have hundreds of thousands of participants. And so they looked at over 350,000 participants, and they identified about 500 young onset dementia cases. That's dementia in individuals younger than 65. And they found 15 factors significantly linked to the risk of developing young onset Alzheimer's. And that included things like education, socioeconomic status, genetic factors, which, as we've talked about, are not modifiable, but may be addressable with different approaches. And then these things like lifestyle choices, addressing health conditions. So the ultimate goal is to achieve successful brain and body aging. Today, we're living in a time where normal aging, we tend to end up with age-related diseases, whether it's diabetes, hypertension, osteopenia, osteoporosis, loss of muscle mass, frailty, Alzheimer's. We tend to spend a long time, the last decade or two of life, really kind of languishing with chronic health conditions. The goal for my center and our team, as well as with our families and loved ones, is to combine the use of lifestyle and health optimization to increase what we like to call the health span. That is to achieve optimal longevity, where you're compressing the morbidity of age-related disease to the last few years, months, hopefully the last few moments of life. And so you can retain a high level of vitality throughout your retirement years and your older adult years. Is this actually being all put together by people out there in the community who are practicing? As a matter of fact, yes. There's a wonderful place called Marama in Vista, California, that's run by Dr. Heather Sanderson. She also has an outpatient clinic, and in her outpatients, she observed improvement in cognition in a sample of her volunteer patients during a personalized lifestyle intervention in these persons with cognitive decline. So you can see the bar graphs here on the screen. They were taking this MoCA test, which I alluded to as a 30-point office-based screening for global cognitive function. And at the beginning of the trial, as a group, they scored at about 20. And you would expect over a year or 6 months that score would either be the same or decline. But with this combination of health optimization and lifestyle adjustments, she actually saw a significant number of patients really getting better. And if you look at a few of the squares, triangles, sorry, they're up at the 30-point mark. That's called a ceiling effect. There's no way to score higher than 30 out of 30. So if you really had harder tests, you might even see even higher scores on some of the people who are participants. And so I wanted to just call out Dr. Sanderson in terms of being her support, that she has really put together a constellation of approaches. They have a residential care facility for the elderly where you can go live for 6 months or more at a time. That's very high end, very expensive to actually live there. If that's not feasible and it's the one location in the world, I think they'll soon have a second location. If you're not able to move there, you can also implement a lot of the elements of the protocol at your home. So she calls that Marama at home. And if that's even out of reach of like buying a course or being part of a participant of a program, you can also just watch YouTube videos. And I'm saying that with all seriousness, that this day and age, knowledge is power, and it really is democratizing access to the best and the latest in the research findings and the approach of how to achieve successful brain aging. So I really suggest that you take some time looking at Dr. Sanderson's work. Thankfully for all of us, she's coming out with a book this summer. So I look forward to reading that, and hopefully you will too. That brings me to my next topic, which is really part of the impetus of me giving a talk today, is to announce Dr. Dale Bredesen's decision to come join us here at the Pacific Neuroscience Institute. As many of you may know, he's been a leader in this area of optimizing health and using lifestyle as an approach to address Alzheimer's disease and or prevent it. He's had a series of papers over more than the last decade, initially on dozens and now over hundreds of patients. And really, he's trained thousands of providers, and there are thousands of cases of individuals who've either stabilized or improved their dementia syndromes by using the concepts, the scientific concepts that are underpinning his work. Nothing about this is simple or straightforward or guaranteed, but we're really looking for a threshold effect, that if you implement enough and you're able to figure out what are the underlying drivers of your memory loss syndrome, that you may in fact be able to stabilize things. And with any luck, you may start to get better. And so they've had pilot studies, they've published on this. And like I mentioned, he is now joining us. Maybe just take a screenshot of this slide. It would take me the rest of the hour to read through it all. But Dr. Bredesen is a world leader and a thought leader in this field. He has authored a best-selling book called The End of Alzheimer's. That's a good place to start if you're pretty hardcore with the science. If you'd like something that's more just how to go about this, I recommend the End of Alzheimer's program book, or like I said, YouTube videos. I believe he puts things on Instagram, which is a little beyond me, but you could check out the gram on how to, and he's quite often hosting seminars with other leaders in this area of health optimization on how to achieve best outcomes with Alzheimer's disease. So Dale is joining us here at Brain Health Center to start Precision Brain Health. He is going to fold in and synergize with us with our existing services, which have really been wellness and lifestyle focused programming. What do I mean by that? Well, again, it would take me another hour or two to really talk through all of our services, but I'd like to highlight a couple points of things that we have. And we do have a website, pacificlifestyle.org, where you can look at all these different offerings in more depth. We really try to have our center be experiential. You could think of it as medical fitness as opposed to being a prescriptive care. So you don't just come in and get a prescription and leave. We really want you to stay a while. We want you to experience the process of working on your health and trying to improve your brain's function over time. It does start with medical evaluations. We're making sure that we're doing things safely. We have a falls prevention program run by a neurologist, Dr. Bill Buxton. He works in concert with a team of licensed therapists and PT. This is Dr. Corwin Pattis, the leader of our rehab group, which is growing day by day to include both not only PT services, but also cognitive rehab through speech and language pathology. And most recently, we're going to add in occupational therapy, both for cognitive and for vision rehab. Now that dovetails into the healthy lifestyle activities, which are meant to be affordable. They are self-pay, cash pay, and or self-directed. Basically doing cognitive training and exercise at the same time. On the center, we're able to have supervised sessions, either in groups or one-on-one, but also catapulted by the necessity of the pandemic, we've been able to set up a number of virtual experiences where you can do classes, either recordings or you can do live classes over Zoom. in small groups. And this is essentially the gamification of exercising, but really embodying it, using your whole body while you're trying to remember something. And the thought about this is that you're enriching the neuroplasticity of the brain while you're doing physical exercise to open this window of plasticity where you can learn more as you're doing a cognitive task. It's basically exercise is the natural way to get brain stimulation and get enhanced neuroplasticity, as opposed to using a magnet or an ultrasound or a surgery or a drug. You actually use your body to generate the increase in brain-derived neurotrophic factor. So in any case, these are some other ones we have. Roadmap to Brain Wellness is a consult assessment to give you a personalized plan to improve your memory and brain health. We were talking about Fit Brain quite a bit. And then the key part, the secret sauce, which I was remiss in not mentioning with Dr. Sanderson's study, the key part is brain health coaching. And honestly, not to be self-deprecating, but I really feel like the brain health coaches are as or more important than physicians or prescribing practitioners because, for example, in Dr. Sanderson's study, the brain health coaches were giving weekly calls with participants about all the lifestyle activities, both for support and also for accountability, to keep people on track, to keep people on target, to troubleshoot. It's kind of like going to the Apple store or calling the Geek Squad. It's like really calling in the pragmatic help when you need it. And so we have our shop. We're both bricks and mortars and virtual, and we have our team members. We're trying to support and help as many people as we can. We need partners in this. We need collaborators. We need practices like Dr. Sanderson's and others across the country and the world. I know Dale has a great randomized clinical trial going on with a half dozen functional medicine providers where they're really getting some of the best outcomes we've ever seen. So it takes a village, and the more the merrier. If you happen to be in the area or you would like to jump online for one of our sessions or classes, feel free to look us up at pacificlifestyle.org or give us a phone call at 213-344-2037. I do appreciate your patience in getting a call back, but we look forward to hearing from you. As now we're basically in the early 2024, we're launching the Precision Brain Health and Wellness program with our lifestyle services, the best and the brightest, trying to do what we can to get best outcomes using Dr. Bredesen's approaches and others. So that's the end of my prepared materials. We've got about 15 minutes left. I'd love to hear from y'all if you have questions, and we'll just take it from there.